Thank you, Elena, and good morning or good afternoon or good evening to all of you. Thanks for connecting. This is really a very nice opportunity to engage and to present this guidance for climate resilient and environmentally sustainable healthcare facilities. I think it's a very nice, friendly, and timely initiative. And particularly now in the middle of this exceptional situation where we are at the moment, I think joining forces at the healthcare sector with other important sectors to make sure that we contribute ourselves, the health professionals, the health services, to reduce this carbon footprint, to make our healthcare facilities more resilient to climate change. I think is a very wise contribution, is a way to contribute as well to this healthy and green recovery that we all expect after the COVID-19, and is a positive one. I think this will generate some positive commitments by our health sector and health professionals, and will be a way to demonstrate that recovery on a green way, on a sustainable way is possible. And this will be certainly contributing as well to reduce the vulnerability of our people to be so much exposed to crises like the pandemic we're facing, or even the climate change big challenge that are all confronting at the moment. So again, thank you so much for your contribution, for your engagement, and for being here today. And hopefully this will be a contribution that add something to the agenda of recovery that we all have in front of us at the moment, and adding a good way to contribute as the health sector and engaging others on this big campaign to face and tackle the causes of climate change, and contributing at the same time to a good universal health coverage. So again, thank you very much for your contribution and for your participation, and a successful day to all of us and to all of you, of course. And back to you, Elena. Thank you very much for the effort and for putting all of this together. Over.
Thanks so much, Maria, for these excellent opening remarks. With this, I will give the floor to Dr. Diarmid Campbell-Landrum, who is the head of the Climate Change and Health Unit in WHO headquarters. Diarmid will give us an overview of the guidance and overall need for this area of work. Please, Diarmid, go ahead.
Thank you very much, Elena. Thanks very much to Maria for opening the meeting, and greetings to everybody wherever you are in the world. So good morning, good afternoon, good evening, Hulavanaka to our friends in Fiji. So just in a few minutes, I'll just give a very brief overview of the guidance. Let me see. Hopefully, this is now displaying. I'll let people shout at me if it. There's somebody shouting. I think, but what the reason that we wanted both to publish this guidance and also to talk about it with you is that, as Maria has said, those of us who work on climate change are basically having to try and support countries around the world to protect their populations from a very wide range of risks that come from climate change, from the ongoing climate crisis. And one of the big challenges that we have is that these risks are so extremely diverse. So depending on where you are in the world, you may be hit by cyclones, you may be hit by droughts, you may be hit by floods, you may be hit by heat waves, you may be hit by wildfires, and unfortunately, you may be hit by several of these things at the same time. This slide that's showing now is basically what I think is almost the summary of 2020, where we have an ongoing climate crisis, which is raising these weather and climate risks around the world, intersecting with COVID and the massive demands, the massive strains that is putting on populations, and the massive demands that it's putting onto health systems. And faced with these range of challenges, we think that the only response is to try and strengthen the health system as a whole. It's because there is unpredictability in which weather and climate hazard will hit which place at which time. It's not like a disease where we can say, here is the disease, and here is the treatment, here is the vaccine. We have to strengthen the whole of the system to cope with all of these risks. And at the same time as we do that, we also have to recognize that the health system or healthcare as an industry around the world is responsible for somewhere in the region of 5% of global greenhouse gas emissions, and that is also climbing. The emphasis that we have at WHO is more on low and middle income countries, because we think that they probably need more of our guidance and more of our support. But we think that the lessons and the general messages that we're putting across should be relevant everywhere. So the aim of this guidance is to try and support countries to protect their populations through healthcare facilities to the range of environmental and climate risks that are now escalating around the world, and at the same time to try and encourage them or give them guidance as to how to get onto a low carbon emissions trajectory in the future. Even though healthcare in the low and middle income countries is not yet a major contributor to emissions, in many cases, the choices that they make, there's the possibility to take choices which are both good for health and good for the provision of healthcare services, and also will put them on a trajectory that is better for the environment as well in the long run. So at WHO, we've worked on climate change and health for a long period of time. We have been talking about this issue, providing guidance, putting out political messages for 30 years now. But I would say it's only in it's about the last 10 years or so that we work very practically with countries around the world, including several which are participating in this call, specifically on strengthening health resilience to climate change or adapting to climate change. And the map that is showing at the moment is every project that we are aware of, which is of at least $500,000 US or more, and is on health adaptation to climate change. And as you can see, there are now a good number of projects, and we're involved in probably the majority of the internationally supported ones. And we have now this good wide range of experiences from around the world on what it takes to strengthen our health resilience to climate change. And we have tried to, as I said at the beginning, promote a whole system approach, a whole health system approach to strengthening health resilience. And based on that early experience from around the world on health adaptation to climate change, in 2015, we published guidance on building an operational framework for building climate resilient health systems, which starts with the building blocks of health systems. We thought it was important to start where health people start, where health systems people start, and most would recognize the building blocks of leadership and governance, information systems, technology, service delivery as the core of building blocks of health systems. And then around the outside of that, we've described how you can build in resilience. So that's something that we've been promoting the whole systems approach for 20 years now, and with very good feedback, I would say, from countries. And where we're at today is that although we say that we have to promote a whole systems approach and even go beyond the health system, it's also true that the front line of protecting health from climate change is healthcare facilities. That's where most health professionals work. It's where most health budgets are invested, and that is the point of contact for most people when they are at risk from these weather and climate events. So we've also got the feedback from our experience with countries that they have a particular interest in guidance that we can give them on what they can do within healthcare facilities as that front line. And the slide here just shows what happens when we get these escalating weather and climate events. I believe this is a photo from Bangladesh, basically showing the destruction of a healthcare facility, and these are the risks that we're seeing escalating around the world. So that is basically the rationale for why we wanted to come out with this guidance. And basically, we take this as a first orientation guidance. It's not going to answer everything that people may want to know to build a perfect healthcare facility that is both climate resilient and environmentally sustainable. But we wanted to provide the overall orientation of the main building blocks that we think people need to be aware of. And I should, at this point, acknowledge that this builds on a wide range of work from many colleagues within WHO, within PAHO, Pan American Health Organization, who have done a lot of work on this. And many of these experiences look at the basic services that healthcare facilities need to provide. So we have colleagues working on energy provision in healthcare facilities, or water and sanitation in healthcare facilities, healthcare waste management. And what we're trying to do is to build on specifically climate resilience onto those core functions. So we have this goal to increase climate resilience of healthcare facilities while also minimizing their environmental footprint. And the objectives are to guide professionals, to support them in monitoring, anticipating and managing health risks associated with climate change, to provide them with tools to assess their climate vulnerability and how they can increase their resilience, and also their environmental sustainability. And basically, as I say, to provide them the introduction to hopefully put them on a path to climate resilience and to environmental sustainability, both now and in the future. And as you can imagine, there are many things, well, as you would know, many of the people on this call work directly in this field. There are many things which go on within healthcare facilities. And what we have tried to do is to focus on some of the core functions to do with both environmental sustainability and climate resilience. So we talk about the core environmental inputs on environmental services that healthcare facilities need in order to run. And the most important of these is always the health workforce, it's always the people. But some of the core environmental services are that we know that healthcare facilities, they need water, sanitation, hygiene, and healthcare waste management. It's pretty much impossible to run a functioning healthcare facility without those. Also need energy, and unfortunately in many places around the world, healthcare facilities, particularly in the poorest countries, many of them don't have reliable energy sources, and they also need to have safe infrastructure, secure infrastructure, and provide technologies and products. And each of these can basically be challenged by weather and climate risks. And the way that that happens is that we have the ongoing climate crisis, ongoing climate change, driving up the frequency and intensity of floods, droughts, fires, storms, and so on, temperature extremes. We have the long-term challenge of sea level rise, which is occurring over decades, but is making it harder and harder to protect the many healthcare facilities that are on the coast, particularly in low and middle income countries. And we also have healthcare facilities which may be challenged by climate sensitive disease outbreaks, which may bring them a large influx of patients. So those are basically the challenges that they have. And what we're trying to work on in the middle is to, as I say, under these main headings, to equip the health workforce with the human resources, capacity development, the training that they need to provide water, sanitation, hygiene, and healthcare waste management services which are resilient to all of those risks I've just described, to provide secure energy services which still work even when you're challenged by a weather or climate crisis, and to consider the delivery through infrastructure technologies and products of services which are both resilient to those weather and climate impacts, and also to be thinking about whether we can reduce the environmental impact as we use those. Because as you can see on the right-hand side of those of this diagram, healthcare facilities are an absolutely critical service to the community, but they do have an environmental footprint. They do produce waste. They can, depending on where their energy comes from, produce air pollution. There can be radiation hazards and so on. They can contribute to, and they do contribute to greenhouse gas emissions. So this is basically the overall picture that we're looking at. I won't dwell on this. We have several sort of conceptual diagrams within the document, which basically make that link between the whole health system approach, which goes beyond healthcare facilities, but then to connect that, focus in, if you like, specifically on the healthcare facility part under these big blocks that I've described: health workforce, energy, water sanitation, hygiene, healthcare waste management, and infrastructure technologies and products. And basically what we're trying to do, and this is another of the conceptual diagrams that draws on information from the Intergovernmental Panel on Climate Change and other sources, is to say that the risk to a community or a healthcare facility is a function of the hazard. It depends on whether you're exposed to an extreme weather event or a chemical spill or some other kind of hazard. It depends on the exposure. So basically whether that hazard reaches the healthcare facility or the population. We try and ensure that it doesn't. And then the vulnerability of the healthcare facility or the population. And so things are worse if you have a healthcare facility which has poor infrastructure, or if the population has a high underlying burden of disease. And so what we're trying to do is basically shrink the hazard, reduce the exposure, and reduce the vulnerability all at the same time in order to reduce the overall risk to the facility or to the population. And we're trying to do all of that at the same time as we reduce the environmental footprint of the facilities. And just again, this is just a quick introduction, but we go through in the document, we go through each of these four domains, if you like, and describe the key actions that need to be taken under each of these in order to build that resilience and to reduce the environmental footprint. I'll just give a couple of examples. One is, again, the most important one, the health workforce. What we think is needed in healthcare facilities in order to ensure this resilience. Firstly, you need enough human resources, and this is always a challenge, but we need to recognize that we need enough people there of the right kinds in order to provide the service. But it's also important, and this is perhaps easier to manage, to ensure they have the right training, information, knowledge management, and the ability to communicate to the population so that they know about these weather and climate risks and they know what to do in order to respond. So we also, to give another example, talk about water sanitation and healthcare waste management. And again, this is a basic service that all healthcare facilities should have, but there are particular things that healthcare facilities should do because of the challenge of climate change. Because if there was already a challenge in providing water sanitation and hygiene to healthcare facilities and populations anyway, it's even worse when you have a flood, or if you have a drought, or if your water sources dry up, or if you have increased temperatures leading to contamination of the water sources. So those are the kinds of things that we think need to be assessed and managed in water sanitation, hygiene, and waste management in the healthcare facilities. And coming towards the end now, we also provide some practical tools, checklists for those managing the healthcare facilities to go through each of these domains, consider the main risks, and consider whether they have plans, capacities in place in order to deal with them, whether it's in WSH or in energy and so on. And coming to the end, we also provide sort of process guidance because it's also important to recognise that this is not going to be solved by in 1 year or through one investment. Climate risks are evolving, information, knowledge is continually evolving about how we manage our environmental footprint. So this is an iterative process by which we should carry out assessments, establish the baseline, define our plans, put into place interventions, monitor how they're doing, and then basically do this on a continuous basis. The final point I wanted to make, it's a slightly different angle, but given that we have healthcare professionals on the participating in this, we also wanted to make the point that it's really important that we focus on healthcare facilities, we focus on the core business of healthcare professionals. But it's also important to recognize that we're only going to manage this climate crisis if we mobilize society and we get communities engaged. And I just wanted to remind people that the single most trusted voice in the world are healthcare professionals. So in addition to managing your own business, there is a role in speaking out on the importance of the climate crisis, talking to the community to carry out that big mobilization that we need to act on climate change. And nobody basically is more trusted than the kinds of people who are engaged on this webinar. So with that, I'll just like to thank you for your attention, to direct you back to the guidance, which is gone live on our website today, and hand back to Elena and to Carlos for the next session. Thank you very much.
Thanks so much, Diarmi, for this very nice presentation. With this, I would request everybody to please mute your microphones if you are not speaking. With this, I would invite Dr. Carlos Corbalan from the School of Public Health, University of Sydney, and also a very close collaborator to WHO, to facilitate the panel discussion. Please, there is a lot of background. Dr. Georgia. Please, if everybody can keep their microphones muted, please, Dr. Corbalan, go ahead. Sorry, Carlos, you seem to be muted. We cannot hear you. We cannot hear you, Carlos. While Carlos solves this technical problem, I would like to introduce to the panelists that will participate in this panel discussion. So we have, I will go through the order as they appear in the session. So first we have Dr. Yemesa Tuvadru, who is the Chief Medical Advisor in the Ministry of Health and Medical Services in Fiji. We also have the honor to have Dr. Amina Shaufa, Director of Public Health Program, Environmental and Occupational Health Division in the Health Protection Agency in the Ministry of Health, Maldives. We also have Mr. Reza Hashemi, Professional Officer, Environmental and Occupational Health Office, Ministry of Health and Medical Education in the Islamic Republic of Iran. We have Mr. Stephen Lindley-Jones from the Water, Sanitation and Hygiene Program in the UK Foreign Commonwealth and Development Office. We also have Ms. Ruth Stringer, International Science and Policy Coordinator at Healthcare Without Harm. And we have Ms. Charlotte Brask, Director of Sustainability Region Stockholm and Chairperson of the European Healthcare Council. With this, I will try to, again, with Dr. Corbalan to see whether you are fine and we can hear you now. I'm afraid we
can you see now?
Yeah.
Okay. I had to change systems.
Okay.
Okay, something went wrong with the other system. So anyway, so thanks for doing that introduction, Elena, that I was supposed to do. I was able to hear everything, and we had to switch computers because for some reason the other one didn't work. But anyway, so what we have now is the panel that has been introduced, and we asked each panelist to consider a couple of questions so that we have a little bit of a structured afternoon. So each panelist, they are listed there, will be answering to 2 questions, and they will have a maximum of 5 minutes because we really need to stimulate a discussion afterwards. So I'm going to introduce the first question and the persons who are going to respond to it. So the question is, how is this guidance useful for your area of work or applicable to healthcare facilities in your country? And it would be nice to hear from Jemesa Tundrabu and Aminash Shaufa, both persons that work in countries, to give us some advice regarding this. Please go ahead. We can commence with Dr. Jemesa Tundrabu, please.
Thank you, Chair. Fellow panelists, distinguished members of the forum, Bulamnaka, and I extend to you greetings from the Fiji Ministry of Health and Medical Services. And we acknowledge with gratitude the honor of this invite. Bulamnaka to Damon Campbell, Landrum at the WHO head office. The guidance that is launched today is very timely and relevant for Fiji and small island development states in our region. In our region and in small island nations, when we talk about the impact of climate change, we are talking about a real and actual threat that is targeting our population health, our identity, and our very existence. The impact of climate change is visible, and the damage is happening in our countries right now. Climate change is pushing us to develop resilience in our health systems and in our facilities. To be able to withstand climate shocks such as extreme weather events, such as king tides and flood and cyclone. Just an example, as you're aware, at the start of the COVID-19 pandemic in Fiji, we were hit by 3 consecutive tropical cyclones in the span of 4 months. And the third one being a severe tropical cyclone, category 4. So Fiji's battle with the COVID-19 started on a back foot, and we had to have to contend with devastation to communities, infrastructure, and agriculture in the midst of trying to mount a response against COVID-19. So building resilience in Fiji means being able to deliver services where and when they're needed, in spite of whatever challenges that we come across, without causing financial hardship to our people. In Fiji, we are finalizing our national guideline for climate change, climate resilient, and environmentally sustainable healthcare facilities, with the support of WHO technical experts, and referencing the draft WHO guideline for climate change and sustainable healthcare facilities. However, Chair, we are also taking a wider and a holistic whole of health approach simultaneously with looking at infrastructure. We're looking at our model of health that is resilient to the climate change. For example, we're looking at developing reserve capacity to respond, in addition to looking at our capacity. We're looking at decentralization of services so that when one area is affected, another area can take up the load and carry the services forward. We're also increasing our outreach capability so that we're able to respond when other health services or area of health services are affected. So these are the ways that we are responding and using to help us prepare our facility for climate. Thank you, Chair.
Very much, Mr. Tundrabu. It's very interesting to hear that Fiji is already advancing and implementing your own or very similar guidelines, and of course, we're going to be very happy to support that work through the office in Fiji. So thank you very much. So can we hear now from Aminath Shaufa, please? Also trying to respond to these two questions.
Thank you. I extend from Maldives my sincere gratitude to WHO and the organizers for giving me the opportunity to be a panelist in this very important webinar. Being a small island developing state, Maldives has always put climate change as a high priority on the agenda, accepting the vulnerable the existence of the island nation and its people. Hence, recognizing this many over the years by the environment sector, and one of the main target of the country is to reduce 10% of its global greenhouse emissions to gain the core benefits of mitigation policies by 2030. Recognizing that the health sector is among one of the major contributors to green health, global green emissions and other toxic chemical emissions into the atmosphere due to burning of all types of wastes, including healthcare waste in the country, is a high priority, and it has been given high priority to reduce the emissions from the health sector. It is very recently that over the last 5 or 6 years, health sector is geared up to take measures to make the healthcare facilities greener, climate resilient, and interventions were initiated, including successful implementation of low emission climate resilient development project in Lamu Atoll, formulation of policies including national health plan, healthcare waste management policy and strategy, mercury-free policy guide, green climate smart health policy and strategy. Also, we were able to conduct WASH assessment in all healthcare facilities. Also has been conducted for the first time in the country, the training on WASH. That has been conducted last year, and healthcare waste management training also has been conducted. With support of WHO, we have also initiated installation of solar panels in 3 islands as a pilot project last year, and also procured waste autoclaves and waste consumables. Due to COVID-19 pandemic, the project is at hold for the time being, and due to dispersion and lack of trained personnel and resources are some of the major concerns and challenges faced at the central level and national level, delaying the implementation of the project. We have a lot more to do to achieve our goals in building a resilient health system to reduce the adverse impacts of climate change. And this guidance document that we are launching today is aligned with complements policy strategy in support of WHO and technical from the healthcare without harm in 2018. Hence, this guidance document will also be very useful for the health sector and can use the guidance document in building health sector resilience in the country. Should I answer to question 2 as well?
Yes, please.
Okay. All the islands are actually unique in the country and differ in the capacity, vulnerability, and also the location of the health facilities. So many of the facilities are closer to the shoreline in the peripheries. And when we implemented the electorate project with support of WHO in Lamu Atoll, vulnerability assessment was done and training program was also conducted before the implementation of the project. Environment sector has already done vulnerability assessments in many of the islands throughout the country, and hence this information can be taken as a baseline. And there are many islands with keen managers who are willing to implement the guidelines. And the vision of the Maldives is to Climate smart healthcare policy and strategy is to reduce the health sector contribution to climate change and adapt to more resilience to the impacts from climate change. I believe we have already started using the guidance document of WHO, and with technical assistance and with enough resources and capacity, we are ready to start the guidance. Thank you very much.
Thank you, Dr. Shafa. I think my mistake that I did not read the second question before you started, but since we have two more persons that are going to be talking about this, I'm going to read it now. However, what I want to say is that it's very encouraging to hear how two SIDS countries are so much engaged in this area. It is so needed in small island developing countries, and that is very encouraging because your experience is also going to be very valuable for other countries as well. We are also going to learn a lot from when you pilot this and you start implementing it, and we can take that knowledge to bring it to future revisions of the guide or work in other countries. So the question really was on communicating, and it says, what recommendations do you have for best practices regarding informing and communicating this work within and outside the health sector? And we wanted to hear from Ruth Stringer and from Charlotta Brask. Ruth, if you're there, you want to start, please?
Good morning. Yes, I'm here. Thank you for inviting me to join this panel. And my colleagues and I at Healthcare Without Harm like to welcome this valuable report. And we're very proud to have been able to contribute to its creation. It's an important step forward in establishing a broad and holistic approach to addressing climate resilience and environmental sustainability. So this cross-sectoral approach is so important to communicating not just within the health sector, but also to higher levels of government and within other sectors. One of my primary areas of expertise is waste, and wherever possible, we try and communicate the co-benefits of climate mitigation and resilience. Concern about waste incineration has historically focused on air pollution with comparatively little consideration of the climate footprint. So with our strategic partners in Nepal, we did some research and we were able to demonstrate that autoclaving vaccination waste has a carbon footprint that is 15 to 20% less than burning, which is the normal approach. And we've always included that benefit in our messaging. By autoclaving waste, we were also able to recycle materials, again with both, benefits for both climate and pollution. And since we've got now a surge in vaccination waste anticipated when a coronavirus vaccine becomes available, this is the perfect time to spread the message that we should stop burning all of this waste and expand sustainable management instead. We're also messaging about the importance of sustainable healthcare waste management in resilience terms. With more extreme events predicted as the climate changes, it's worth knowing that sustainable healthcare waste management systems we put in place in Nepal were able to weather the 7.8 magnitude earthquake that hit in 2015. And our strategic partners are working with development agencies now to install more to help with the COVID outbreak. I'm also like to send my greetings to Dr. Shafa from Maldives. It was my pleasure to work with her on their health and resilience project 2 years ago. And I hope that they're inspired to keep pushing forward with the waste management even during the COVID outbreak, because it is a really important aspect of that. Thank you.
Thank you very much, Ruth. I think you touched upon a very important point, which we have it in the guide, and I don't know everybody knows, but Healthcare Without Harm was part of a group that helped us develop the guide, so they are co-authors. So very important point indeed. We also have responding to this question, Charlotta Brask. Are you there, Charlotta?
Yes, hello, good day.
Please go ahead.
Yes, thank you. Thank you for giving me the opportunity to be part of the release of the guide. I'm the Sustainability Director of Region Stockholm that provides healthcare services and public transport for the greater Stockholm area, serving 2.3 million citizens. I'm also chairperson for the European Healthcare Climate Council, which is a coalition of hospitals and health systems that are committed to strengthening the health healthcare sector's response to climate change. For the communication within the healthcare sector, I believe it's important to align climate change communication with health impacts, focus on disease migration, premature deaths, and mental health impacts of climate events. That attracts your internal audience as they can see a direct link to their core business. And of course, the medical doctors have a strong influence on the culture and leadership in the organization and are needed for sustainability to become an integrated part of the management of healthcare and not just a side issue. I think therefore this guide is so important. The fact that an organization like WHO releases a guide gives credibility to the importance of a climate resilient and sustainable healthcare sector. And it specifically addresses the health professionals as one of 4 fundamental components for achieving this. And I also believe that high ambitions regarding environmental sustainability is also a prerequisite for attracting younger generations so they want to work within the healthcare sector. And also with COVID-19, the public sector in general, but healthcare specifically, has been given a strong leadership role, an organization to be trusted in time of crisis. I believe we should use that role of leadership to contribute to a transition into not only a sustainable healthcare, but also a sustainable society. But to strengthen the messages, it's also important that health systems coordinate and collaborate. In the European Climate Council, we are working to develop a common roadmap for climate smart healthcare in Europe. And the object is to publish a framework document detailing a common methodology for measuring the national climate footprint and developing a national level roadmap for the decarbonization of healthcare. Another important area to communicate, I believe, is the deliverance of healthcare is dependent on a complex and extensive matrix of suppliers. The healthcare sector needs to communicate its ambitions, both in dialogues with suppliers and via clear sustainability requirements that reward the companies with sustainable solutions and force the others to transition to more sustainable services. And the companies are often global, and the same products are used all over the world. Sustainable procurement is an area where we should collaborate more, I believe, to speed up the transition. And especially for developed countries, the largest part of the climate footprint lies in Scope 3, the consumption phase. Yes, thank you. I just wanted to ask if I should elaborate something on the question 5, financing, or if I should stop there.
No, let's stop here because we have one more person that needs to speak in this second question. But are you very nice and surprised and happy to hear that you are developing something related to the health climate footprint? Because that's the next step for us. That's extremely important. And I think you got such an important point regarding procurement, because this is something that it has been identified as really a very, very important issue. And it's something that we realized when we were preparing the report, is that sometimes the healthcare facilities themselves have very little control regarding procurement because it's done centrally. So sometimes we have good ideas in the guidance for healthcare facilities, but we do explain in there that sometimes you really need to go outside to those that make bigger decisions, for example, where your energy comes from or where the things that you buy for your healthcare facility comes from, etc. So very, very useful and interesting to hear that. So the third person that is going to speak on this question on communication is Reza Hashemi. Are you there, Reza?
Yes, I'm here.
Go ahead, please. Thank you.
Okay, thank you, sir. Good morning, good afternoon, and good evening, ladies and gentlemen. Let me to repeat question number 2. What recommendation do you have for best practices regarding informing and communicating this work within and outside the health sector? Actually, for this project, we can consider a step-by-step approach. First of all, we will collaborate with the offices of health system, hospitals, emergency and disasters, and other relevant sectors to health in all policies within the Ministry of Health, also other sectors including governmental and non-governmental. After that, we would choose some healthcare sectors such as hospitals, clinics for piloting in some different climate conditions of the country. After that, I think it's better to adopt and localize the guidelines. So in the next steps, we consider capacity buildings for the workforce and the other parts. And in the next step, we will gather negative and positive feedbacks and implementation notes. And then we then improve or revise for operation phase in healthcare facilities, especially for times of emergency. And finally, we scale it up for other health care centers and other areas. That's all, sir. Thank you.
Thank you very much, Chris. Yes, no, I think that it's so true. You know, the fact that we are all sort of participating here, and probably everyone is very much in agreement with the need to do this, but it doesn't mean that it's easy to communicate this internally with the health sector. There's a lot of work that we need to do. It's difficult to communicate to other sectors, but even internally, the priorities, the need to do this type of work is not always there. I think it's now a lot better than what it used to be. So I think the time is right. So if we play our business right, our cards right, I think we are in the very right time to start implementing the proposals that we have here. I'm going to go to question 3, and it says, how should piloting be conducted? Do we have places that are ready to start using this guidance? So maybe from your own experience in countries. And this time I would like to start with Amitnath Chaufa. Go ahead, please. Okay, maybe we go to Jemesa Tundrabu. Are you able to respond to that one?
Yes, Chair. So thank you for the question. So for Fiji to pilot and implement the guidelines, Fiji has drafted a standard operating procedure, SOP, to help the Ministry of Health in implementing or operationalizing the guidelines. The SOP has 3 distinct phases: the pre-phase, the in-phase, and the post-phase. The pre-phase has 5 steps, which includes the training component, the initial assessment, analysis of report, and the recommendations and the plan of action. The in-phase, which is activating the plan of action, also has 5 steps, which looks at the scope of work and the designing, the local authority approval, the contractual and tender process, retrofitting, and construction works to completion, capacity development, communication, and awareness. And the post phase is about monitoring and evaluation. In addition, the SOP provides a table for categorizing the different levels of healthcare facilities that we have, and the prioritization tool for selection of healthcare facility and selection of the intervention, and the reporting platform. We are collaborating with the WHO Fiji country office in piloting the implementation of the guideline, and we are organizing a week-long training workshop in November next month, which will include simulation exercises and field visits to test our assessment tool and processes. Early next year, we will identify the healthcare workforce, the healthcare facilities that will be assessed using the checklist, We will consider both hard and soft adaptation and mitigation measures that will have solid and identifiable impact on the ground, and we'll have in place the reporting system for credible monitoring and analysis of the progress. We look forward to implementing the guideline and to contributing to reducing our carbon footprint to protect our environment. Thank you, Chair.
Yeah, thank you very much. Yes, I've heard that you were doing this workshop, and I think it's very, very interesting, very timely, and I'm very glad that we have this guidance document ready for you to start using it as needed. We're going to call again Risa Hashemi. Go ahead, please. Risa, are you there?
Yes, sir, I'm here.
Do you want to respond to this?
About question number 3?
Yes, piloting.
Yes, pilot. Actually, I want to say my country has different climate conditions and areas. So in this work, we are able to pilot these guidelines based on these areas. Actually, as I said, according to the climate condition areas. So we suggested to have 6 piloting areas. In each area, we will have 3 types of healthcare facility for our pilot. The first one is health house, secondly is clinics, and the third one is hospital. This way, we will be able to reach different level of health system accesses and within different scopes in terms of communities and their relevant resilience in the context of healthcare and especially at times of emergency. Sorry, I briefly said some things about question number 3. If you have any comments or questions, I'm here.
Thank you very much. No, that was very useful. I just want to see whether, I know you answered this, but is there anything else you want to add after hearing your colleagues? Okay.
Actually, we have also selected 3 islands here, and we have started implementing implementing the energy component and also the waste component. So I think we have already started implementing the guidance document, and we will proceed further to we will escalate to other facilities as well in the future. I know it takes time, and it also needs more resources and capacity building. So though we want to implement it as fast as we want, there are delays in the implementation process due to capacity or financial resources. Thank you.
Okay, thank you. Yes, good to hear. Thanks very much. I'm going to go to the next question on mainstreaming, and it says, how should the guidance be scaled up and mainstream to support local healthcare facilities and communities? And we're going to invite Stephen Linkley-Jones and Ruth Stringer. So maybe, Stephen, we can start with you.
Yeah, hello everyone, and I hope you can hear me.
Thank you. Definitely, yes, thanks.
Great. Well, firstly, thank you very much for all the presentations so far and for inviting me to be on this panel. I'll just say a couple of words first. So the UK, through the FCDO, is really interested in this area, both because of the importance of climate resilience to health system strengthening, but also, of course, the wider picture that Diarmid talked about about hazards, risk, climate change. And these are the sort of areas of thinking about this within a sort of all hazards approach that we're thinking about in the run up to COP26. And then on the specific question of mainstreaming, so I think the first thing I would say is making sure that we all learn from others. So it's been great to hear from other panelists so far, from Fiji and Maldives, for example, about some of the piloting that's already gone on. And I think the lessons from that, how the guidelines can be used, how they can be adapted or developed further in the local context, will be really important for mainstreaming more widely. And then a couple of other points. So I think it's really important when we think about mainstreaming to get to the right decision points and the right decision makers. And some of the other panelists have talked about that these may be, outside the healthcare facility, or they might be outside the health service or sector itself. So I think it's really important to identify and target those if we want to mainstream and scale up. And that's part of the point that Diarmid made earlier about thinking of this approach as part of overall risk management and thinking it as part of climate resilient health systems overall. And I think the final thing I would just say is making sure we build on what already exists, build on where there's good work already. I think it's quite helpful in the guidance that it talks about the importance of looking at both shorter term and longer term priorities, so that it's possible to demonstrate already what works. And then there was a great question in the chat, I thought, from Lynn Madden about what's the role of the education sector and training for health professionals in this. So in terms of a broader scale up, I think the aspect of longer term training and education is really important to think of as well. I'll finish there on that question.
Thanks so much, Stephen. I think yeah, we've heard this also from I think Diarmid and maybe another speaker, and we put it in the guidelines how we must learn from others. Like, this is all new for everyone, so there's not a lot of experience in doing this. Perhaps developed countries like the UK have done more work. Some of that work can be translated directly to developing countries, others cannot. So we're going to be learning quite a bit and probably revising this in the next couple of years, because the richness of the work that it seems to be coming out from what we're hearing is pretty amazing. So Ruth, do you have comments on this, please?
Yes, thank you. I think one of the key things, my sound is okay, I think? Yes, I think one of the key things for mainstream is to share experience across organizations. Back in 2013, I was part of an informal interagency task team on sustainability in procurement, which has led to the very important SHIP project, which is Sustainable Healthcare in Procurement project. And I believe we've got the leader, Dr. Kumwenda from UNDP, here on this call. Now, during COVID, we've also been part of convening an interagency informal group with WHO, UNDP, UNIDO, and many others, and waste management experts who've dealt with previous pandemics, including SARS, MERS, and Ebola. So we're able to share experiences and best practices there to prevent some of the regrettable developments that have happened being repeated. I mean, for example, in the first phase of the pandemic, some countries started to classify all waste as hazardous, which, could see some understanding why that would happen. But they found themselves with the unintended consequence of having suddenly 6 times as much infectious waste as normal and overwhelmed systems that had previously been functioning perfectly well, and ended up having to incinerate huge amounts of waste. Recycling schemes collapsed as well. So we've been able to reassure people from these different agencies on what the best practices are, and then, you know, the fact that a system that's working well pre-COVID is actually able to cope with it. And so this sort of interagency group should be continued and expanded in other areas to help facilitate mainstreaming. Then at the individual level, I think that the fact that they've got, the guide includes several different case studies in each chapter is very valuable. Healthcare Without Harm's Global Green and Healthy Hospitals Network also publishes case studies from the hospitals within our network on climate, food, many other subjects. And so these can be, anyone can read these, and these are very useful for individuals to learn about the possibilities of things that they can work on, and also to inspire them to realize that, you know, including climate change in your daily work should be part of the new normal. So, you know, with our Global Green and Healthy Hospitals Network, we also have our own resources, and so we're very happy to work with WHO on starting to implement and continuing to implement this very important work. Thank you.
Thank you very much, Ruth. And I'm noticing now that in the chat, some people are making comments, and I would encourage others to tell us what other activities are happening in the countries that you know of. But for example, there's something from Anne Paul saying that they are also starting to pilot this work, and perhaps there are other countries as well. So I'm going to go now to the final question. I think we have a few more minutes, and when we finish this, I would like to open to some discussion if we have time. But this question is very relevant because it talks about financing, and this is probably a weak point for many of us. Where does the funding come from to do all this? So the question says, how can we promote investment in promoting climate resilience and environmental sustainability for healthcare facilities? So how do we attract the funding, work with people, build the partnerships so that we can have the necessary funding to do this work? So we can start with Stephen, please.
Thank you. So this is a great question, and obviously we all know that many of us are working in sort of very constrained scenarios in terms of the financing available. So I think the first thing I would say is really look for the sort of early wins options that are possible with the resources already available, and then build from those in line with what the guidance suggests about some of the looking for sort of the short-term priorities and so on. And I think we've got a lesson from some of the work that the UK has already funded with WHO on climate resilient WASH, including climate resilient water safety plans. That showed the real importance of proceeding with small investments while you can, to get a demonstration of what can be done, how this can be put into practice, and then working out what the longer term investments are needed, and making the financial case for those in the longer term. So I think it's this combination of doing in the short term what's possible with the immediate resources available, while making a really key case for the longer term investments as well.
Excellent, Stephen. Thank you very much. Charlotte, do you have some recommendations from us in this point?
Yes, please. This is a global guide, and I believe that the conditions for having a resilient and environmentally sustainable healthcare facility differs between countries. But starting with the infrastructure and the distribution of energy, water, and waste management, healthcare organizations are usually, but not always, strong buyers. So if you add environmental criteria to the contracts with suppliers, is one way to steer into the right direction. I mean, you need to use the money to have energy, but you can, so you need to buy this, but you can add really strong environmental criteria. So this has, for example, resulted in 100% renewable electricity, 96% heat and cooling at our hospitals in Region Stockholm. And the fact also that 100% of our buses run on renewable energy is due to environmental criteria. I'm back to procurement again. But important to note is also that the climate emissions from the construction phase of a building account for 50% of the property's total impact during a 50-year life cycle. And the politicians in Stockholm has recently adopted a plan to mitigate climate emissions to reduce the climate impact in construction and civil engineering, and that also helps to turn that industry into a more climate-friendly industry. But another success factor is to integrate mitigation and resilience measures as an aspect in the investment process. Thereby, it's included from the beginning in the investment phase or planning for both new constructions and renovation projects. And in addition, you need to have tools for calculating short and long-term projects savings for both facility management costs, but also savings due to improved health outcomes over the lifespan of the hospital or facility. And my final point is that using, for example, green bonds for financing new hospital buildings and renewable energy and energy efficiency projects is also a great opportunity. In terms of risk, return, legislation, and documentation, green bonds have the same characteristics as other investments offered on similar terms. But the benefits of green bonds are diversification of the investor base, makes it more robust, lower interest rates, usually, than traditional bonds, and an opportunity also for both the borrower and the lender to communicate the environmental ambitions. Thank you.
Thanks very much, Charlotte. So it seems that it's very likely that if we could take action now, we would actually be saving money. The question is, we need to convince someone that this is a saving. It's not a saving immediately, it's a saving in the mid to long term. But first we need investment. So this is the small issue we need to resolve. Now, we asked this question to persons from Europe. I would like to know, from Fiji, for example, was it hard to secure funding, or from the Maldives? Since we are both implementing this work, was funding an issue or it was never seen as a problem? So, Dr. Tundravu.
Thank you, Chair. Funding is an issue in situations where you have competing priorities. And I mentioned earlier that when we look at strengthening health care resilience, because we're in a desperate situation, we are faced with the effect of climate change now. We are looking at a holistic view of health services, not just limited to any particular area. So to develop those areas, we need funding, and funding is always an issue. So we look to development partners to support, and we've had good support from development partners to support areas that we as a ministry cannot support, allowing us to be able to simultaneously move projects forward that will build resilience in our health system. Thank you, Chair.
Very much. And Dr. Shalfa?
Thank you. Funding, it is an issue for the health, especially related to funding. The climate funding mostly goes to the environment sector, and is a very small amount, especially only mostly from the WHO funding. So it is an issue, and also we are not able to get funds for these projects from the government as well. Hence, yes, it is an issue in accelerating these projects and implementation. Thank you.
Right, yeah. At least you have started. So once you are able to prove the value of this, maybe this becomes less of an issue. So we are 5 minutes from the end of the session. I would like to ask if any of you would like to have a last say, a last comment. Charlotta, any last words from you?
No, thank you. I'm fine.
Okay, I'm not going to mention names. Would anyone like to make a comment?
Hello, this is Rahim. May I have a point?
Yes.
Hello, this is Rahim from WHO Country Office, Iran. Thank you very much for the comprehensive presentation and the very enlightening and informative discussions. I'm wanting to know that what would be the internal, WHO approach between different sectors and units. Because as it was discussed also today, this is a intersectoral and cross-cutting subject, which needs the collaboration of health system, emergency and disaster management, and also the climate change environment health, as it is also in practice dealt, in the similar with similar approach in the country level, and the example is for Iran. There's no time for giving some further background about the works which was done in the health system in Iran regarding the disaster and resilience and response, and also in the emergency sector. I do believe that also inside of WHO, this will need the close collaboration and also having the both departments of the health system and WHE, especially the disaster and response program, joining to this pilot and program. Over to you. Thank you.
Thanks very much for that comment. Let me clarify that we did not open for questions, because we will open in the next session. So whoever is worried that they don't have a chance to speak, that's going to be the participants. That's going to be the next session. And we're going to close now. I'm not going to attempt to summarize, because that's going to be done at the end of the webinar. However, just to say that I'm very happy to hear that there's a lot of work going on, that everybody finds this work very useful and timely, that we're launching this now, and that we are definitely willing and able to, all this group, to work with each other, to learn from each other, and to support your work. So I would just by saying thank you now, and I would like to give the floor back to Elena, who's gonna announce the next session. So to the panelists, thank you very much.
Thank you, Carlos, and thanks to all the panelists. I think this was a very nice panel discussion. With this, I would like to invite Mr. Hassan Nasir, who is the team coordinator and environmental specialist in the Pacific Climate Change and Environment Division of the Pacific Technical Support in WHO Western Pacific region. Nasir is going to facilitate the next session, which is an open discussion on priorities and next steps to strengthen resilience and environmental sustainability in healthcare facilities. So please, Nasir, go ahead.
Thank you, Alina. Can you hear me well, Alina?
Yeah, we can hear you.
Thank you. I think, to me, I really appreciate the intervention and the start presentation from Jarmit, and then the expert and the panelists that has intervened just now. Very, very useful. But then I have seen also some comments and from the chat, and also at the same time comments by Mr. Rahim just now from Iran about this work itself. So now I don't want to further elaborate. It's just that I will probably like to seek all the participant intervention and views about the way forward, rather than looking into the comments into the guidance itself, but more like where do we want to move from here? To me, as I mean, in the system for quite a while, this is a real opportunity, as what been discussed, elaborated just now. When we talk about climate change and health, people asking like, what do you want to see on the ground? Well, how do you want to implement? How do you want to introduce that climate resilient systems, or even in this context, healthcare facilities? So, with this, I'm able to say that this is how we are going to do on the ground, and like strengthening what we call healthcare facilities that are resilient to climate change. This is putting all the theories, all the concepts that we have discussed thus far into the context of the systems on the ground. But having said that, it is not as easy, because we are talking about healthcare facilities having different sizes. Some are small, some are big, some in remote island, some in big countries like China, or probably to some extent like Iran. But at the same time, different capacity and different priorities at the same time. So the question is that where do you want to start, or how do you want to start, or where to prioritize? And this is where probably I want to start with the intervention by Rahim Takizadeh just now. You were asking about how do you want to bring other components of the health systems into discussion here? How do you want to bring WHE? How do you want to bring health systems and together with the climate and environmental teams into the discussion to make sure that this is not like a silo process. This is an integrated process. You want to elaborate one or two more sentences, Rahim, from there?
Yes, thank you. Thank you very much. Okay, to be very short, I would like to, for example, say that in Iran, an emergency and disaster assessment tool was developed 3-4 years back for health system. And this is a self-assessment tool which was integrated in the system, and all health service providers from the public health services, hospitals can. Hello, do you hear me well? Because I hear myself lots of noises. Hello?
There's been some noises from your side, Rahim. So
Might be it's from my side. Let me check my system, because.
So you want to make some final remarks or some final intervention, because I think that it's a bit noisy from your side.
Let me try to fix the problem, because it will be it will disturb our audiences. Then I will try to add to this point.
Okay, thank you. May I invite others as well? And
hello.
Stay behind also if you have any comments at the same time.
Hello. Can
yes.
I come in? I'm Dr. Rameswar from the National Program for Climate Change and Human Health of India. Yes, we are, working in this developing green and climate resilient healthcare facilities across the country. We have, developed some principles, and we have principles on this green and climate resilient, and this have submitted to the, and this accepted by this Indian public health standards. These are the standards which gives guidelines for developing these healthcare facilities across the country. In India, as we are all aware that is a huge country with different geoclimatic conditions, and we are working in this area since April 2019, and we are trying to develop these health action plans regarding these green and climate resilient facilities. We are on the process when we are trying to develop this health checklist also, and the loans from WHO will also support us, will also help in guiding us also. And in the last year, in this year only, we have prioritized the healthcare facilities, which we call health and wellness centers in India, and some 5 important geoclimatic conditions in India, which are impacted by the climate change in terms of cyclones, in terms of heat, in terms of mountainous and hilly areas, in terms of floods. These are some identified areas we have already on the plan, and we are trying to develop these healthcare facilities in these areas. And there are some reports also from WHO side also. We have been looking in that in Madhya Pradesh, one states in India, where they have also done some this assessment to healthcare facilities in 2 districts in the state. Like that, we are on the process. Because of the pandemic, there has been some lagging in that, but we are now this coming up again. We are trying to discuss on that, and we are moving forward in this area. And the launch of these books and these documents will be huge support to us in the days to come for us also. And we are looking forward to getting sharings from across the world. I mean the piloting, your experiences in developing these these healthcare facilities, and that we will be looking up so that we can also in days to come in the futures, how that can be accommodated in India or developing. As we all know that India is a very huge country, and which are very much impacted by this climate change in a highly magnitude size. So thank you to WHO for allowing all of us to be part of this. Thank you very much.
Very good, Dr. Rameshwar. Fantastic. I think very good intervention as well. So any more, please? I mean, because I don't know how to prioritize your intervention. It's just like you may have to unmute and then shout, probably telling me that you want to intervene. Anyone?
Hello, this is Rahim again. I think the problem from my side might fix.
Hello, we lost you, Rahim. Okay, while waiting for Rahim to re-intervene, anyone?
Yes, this is Rosemary, if I may.
Yes, Rosemary, please.
Thank you very much, and thanks to WHO for the launch of this useful tool. Thank you also to the panelists who have been extremely punchy and communicated their messages very, very clearly. I wanted to just share a little bit about the SHIP, since I see some questions in the chat box, the Sustainable Health in Procurement project, and also the work that we do with Healthcare Without Harm with support from CEDA. You talked about resource mobilization. Wanted to actually share with you that what started off as a partnership of a small amount of money from SCORE Foundation and UN Foundation, UNDP and Healthcare Without Harm, through our various networks of global green and healthy hospitals, but also the sustainable health procurement initiative of the United Nations. We have grown from a small project to a much bigger project covering the 10 countries. So really, SHIP is a vehicle through which we are learning and sharing experiences throughout the globe. I mentioned that we're in 10 countries, Argentina and Brazil in Latin America. we are in South Africa, Tanzania, Zambia in Africa, and Asia Pacific, we are in Vietnam and China and India, and in Europe, Moldova and Ukraine. So you can see that the coverage really has tried to reach the globe in terms of ensuring that this project, which aims at demonstrating sustainable procurement in the health sector, to look at the intersection between health, human rights, and environment in developing countries especially, but also the emerging economies of India, South Africa, and Brazil, through which Healthcare Without Harm brings the practices from health facilities. We combine policy level, leveraging from the actual practice with health practitioners, looking at how to reduce greenhouse gases, how to ensure energy efficiency in the health sector, and also how to ensure that, in providing health services through procurement, we're not depleting resources. So these are the three focus areas, but we have managed to move forward and ensure that we bring in the dimension of healthcare waste, so that there's a total cost of ownership of products, but also looking at the sustainability of what we procure. Now we are working on an index, the Sustainable Procurement Index for Health, and we have an experts group, which again is composed of experts from around the world, so that we can have a consensus of what constitutes sustainability in the health sector. So we really are happy that WHO has brought in this new dimension of a tool that will help us use the tool with health providers. And I want to also mention that with WHO Europe, we are going to be launching a white paper on health and climate change. And it includes very practical recommendations for safeguarding health, for example, in the Paris Agreement, integrating or mainstreaming social environmental sustainability and climate resilience health systems, engaging with health professionals, and applying gender and human rights-based approaches to protect vulnerable groups. So it's an exciting time, especially as we recover from the COVID. Definitely everyone is talking about recovering greener, recovering more sustainably post-COVID. Let me end here, but happy that I was part of this very auspicious day of launching this tool. Thank you.
Thank you, Rosemary. It's just that before I give others the floor, I want to ask Rosemary, can you introduce yourself and where are you working or based at?
So my name is Rosemary Mwenda. I'm a medical doctor by profession. I'm the team leader for health and development in Eastern Europe and Central Asia for UNDP. I'm based in Turkey, Istanbul, but I also coordinate the United Nations Informal Interagency Task Team on Sustainable Procurement in the Health Sector, which is a global initiative of the UN, so that we measure the sustainability of what we procure as UN agencies. So very happy to have been part of this inauguration. Thank you.
Thank you very much, Rosemary. And then I also guess that you also stay connected to our dialogue, to our team here, even after our session here at the same time, so that because it's very important for you to get involved with regard to sustainable procurement, the indicators that you have proposed as well. I also want to get Dr. Rameshwan from India to also share with us if you have also the national guidelines with regard to the climate resilient and environmentally sustainable healthcare facilities in the context of huge country like India, and also the experience that you share with regard to Iran. Okay, so now I open probably some more intervention from colleagues, friends from all over the world to this dialogue here. Prioritize what's next. What do you think the next phase or the next stage to move on from here? So then there's also suggestion from Laura and Galeti. Said it would be useful to provide more guidance for financing healthcare projects via green bonds. Anyone knows about this? Green bond, or probably in the context of GCF, in probably this is also an opportunity for us to come in a big effort towards supporting healthcare facilities, building healthcare facilities. Anyone want to come in?
Ruth Stringer here. I can't say a great deal about green bonds, but I think there's one comment worth remembering regarding finance in general, is that we need to be tracking the cost savings that go along with climate-friendly healthcare. Our own climate challenge has, I think, 200 institutions now representing 22,000 healthcare facilities in 33 countries. And by 2019, they'd committed to reducing carbon emissions by 34 million metric tons, which is the same as 9 coal-fired power stations. And together, they had recorded $400 million in cash savings through just reduced energy use. And also that adds up to $3.2 billion US saved in healthcare costs. So I think it's really important that we build this into all of the climate work, but we also need more tools to start tracking the health benefits of other aspects of environmental sustainability. Thank you.
Thank you, Ruth. Very, very useful. Okay. I don't want to lose that discussion. Any comment, Jarmit, colleagues, about this, the co-benefit tools, or probably the positive impacts of building our own climate resilient and environmentally sustainable healthcare facilities, bringing benefits as well. So any comments or intervention to what Ruth proposed just now from colleagues, from anyone?
Yeah, yes, Charlotta is here. Hi.
Yes, please. Yes, please. Introduce yourself.
Yes, yeah. I was just touching upon before that, but you do have investments. It's really, the noise is a bit, okay, right. Usually you do have investments during a year. You have a long investment plan. So what I was touching upon before was important to include all this mitigation and resilient measures into the investment phase, because you do spend money on your buildings or construction, whatever, and you can, as early as possible, introduce these kind of aspects. You do save money, and then you can also add on these different, as Ruth was speaking about, tools for calculating how much you save directly or how much you save within 10, 15, 20 years in order to do all these interventions in your buildings or constructions, whatever. So I think it's really important to integrate sustainability into the strongest processes, would you say, where the money flows in the organization. And then you can also show that if you build in a certain way, you use different materials, whatever, you actually save money up front as well, not only after 10, 15 years. You usually think of these things a little bit too late in the investment phase. You have to investigate it and analyze it before you take your decisions regarding the long-term investment plan, for example. And then you can also earmark some of the projects to say that you're going to use green bonds for financing these and that projects. And then you also have you need to have a little bit higher ambitions, sustainability ambitions in the projects in order to have the investors. And when you have the investors on board, you need to keep the sustainability, the prestanda at a certain level in order to have the investors, to make them happy. So that's also a way of closing the loop. You get green money, And then you have to continue to be green all through the project. You have to show the investors that you actually managed to do what you have set up. And then everyone is happy in the end. So that's also a solution.
Thank you so much. Any more intervention with regard to that investment and the green bond, or in that context just now?
Hi, this is Stephen again. I just wonder if one way of thinking about mainstreaming, for example, is we can say that these approaches are really mainstream when the investment case and the investments are fully into the existing budget cycles at different levels, and really taken into account there, because we know that this sort of got referenced before, sometimes at the sort of pilot stage of a project, it's quite common that funds might come from development partners for something relatively small scale. But we know that for genuine mainstreaming and scaling up, it needs to be part of the full budget process and so on. So I think that's almost one area where we could look at the links between financing and mainstreaming.
Great. And I was also, I really support that idea. Because I think the moment you look separately as like taking the climate and environmentally sustainable components separately, then it can be some problem. But if you use mainstreaming, I can also see this provide a new integrated system, if I were to use it. So you're still building or retrofitting hospital in the context of retrofitting or building new hospital, but then you are building and developing a new perspective, and rather than like patching the environmentally and climate resilient components, but you will see this more in a more integrated way. I don't think it's going to incur additional or excessive additional cost in comparison to the benefit that you develop a sustainable climate resilient healthcare facility in the long run, as what Ruth probably intervened just now. So there must be some way or mechanism. You shall see this in the context, in the broad context, in the overall context. If you see separately, then it can be some problem. But if you look into this as integrated component, then you will see that it is going through as a systems. And you use just now, Stefan, about streamlining. You are talking about integrating and the process itself. So, any question to that?
Chair, can I come in?
Yes, please.
Yes, I'm Godlieve van Heteren, based in Amsterdam.
Yes.
But also working for the WHO-hosted Health Systems Governance Collaborative. Can you hear me?
Yes, I mean, are you the one also looking intervene about the COVID-19? How do you want to deal with this climate?
Well, I put several comments in, and I want to sort of wrap them into one question to the speakers.
I was about to also to pick up your comments, but please proceed. Please start the intervention, please.
Well, as somebody who's not per se in climate environments, but very much working in health system strengthening for the larger part of my life and in health governance, I think you're a bit too modest, some of the people speaking here, because basically, if you look at the way the world is in fluidity now due to this COVID crisis, I think it's very clear for everybody who thinks twice that the next frontier of issues will come from this wider range of climate challenges. So that case, I think, hardly has to be made anymore. I think it's for everybody to see. Now, the question is, I mean, as to financing, there's so much money floating around now in the COVID efforts, which, are focused on specifics, but basically there's also a lot of free-floating money still. I think this is the moment to, in a way, grab the arena and say the next frontier is going to be our planetary health. So one comment I posted in the chat box was to do with the planetary health as emerging field. all these climate-related initiatives in health, for me, are very much part and parcel of that emergence. So I think you're on a tidal wave, and you have to maybe step out of the more traditional ways of seeing budget lines, and basically see it much more in the larger context of the world now becoming very, very aware of the climate conditionalities, and that are also at the roots of some of the COVID misery that we're facing altogether. So my sense is, or my question to everybody is, what mental frames or what frames of normal standard operating procedures should we maybe push aside now and look for other ways of organizing things to bring all these aspects together, because it is part of our planetary health. And so my sense is, don't box yourself into the older ways of doing things, even though that might seem had the most likely route to proceed when you work in a ministry, etc. But push yourself out of it at the moment, because I think the next disaster is already around the corner, and in many places people already experience it. So we really need to think newly about this.
Great. I saw a great intervention from you. How do I call you? Godlin?
It's Godlief. It's actually an old Flemish name. It means the love of God.
My
parents were very Catholic, but I'm no longer.
I think a very good intervention from you. And I mean, I really want to invite you. I mean, you just came in the right time just now. So definitely your comments will be recording or probably taking notes of all your comments, and especially when you want to look into this climate and environmental perspective in the context of planetary health. This is also a discussion that we also have it in our region, in the Western Pacific, especially also in the context of the Pacific. Don't leave out with the fact that you're talking about ecosystem health. So how do you want to establish and strengthen this? And this is also where I started with, at the same time that yes, these are very crucial, but at the same time we have to look into some kind of reality on the ground, without having to lose, as you rightly say, Godlief, that don't ever take out the broad and important perspective of climate or planetary health. So we will discuss this further, your recommendation, and I've seen 2 or 3 interventions that you put in to make sure that we will address them accordingly into the discussion that we have it here. I may ask for one final intervention from colleagues, friends, from anywhere or everywhere or whenever you are. Please.
I see the hand is raised from Dr. Rajiv.
Yes, please.
Good afternoon and good morning,
yes.
Good evening, wherever people are, because I see the whole world is in the discussion, and it's very relevant and apt that this guidance is being launched on 13th of October, which is also Disaster Risk Reduction Day. Resilient and environmentally sustainable healthcare facilities, when we talk, are we also keeping in mind the local and tribal cultures, the traditional healers, the traditional practitioners, vis-a-vis modern scientific system of medicine practitioners? This also is important, because if it is to become sustainable, this is all the more important that all the stakeholders in the healthcare system are taken into consideration. That's point one. Second, if it is to become sustainable, also financing has to be made more wide-based, meaning more globally aligned and also equitable. Equitable in the sense that developing and developed world need to collaborate. Is there any plan to have a platform for collaboration on financing the global growth of climate resilient and environmentally sustainable healthcare facilities. Thank you.
Thank you, Dr. Rajiv. And anyone to respond to one last? I have to say the last one now. I have already said the last, but then I want to open up one or two more, probably one more. One last intervention from friends, colleagues.
Good afternoon. This is Dr. Purnima Prabhakaran from the Public Health Foundation of India.
Yes, please. Yes, please. Probably could be the last, if you don't mind, everyone, colleagues, friend.
Yeah, thank you for that opportunity. And first wanted to say congratulations to WHO and partners on the launch of this framework. But I just wanted to also caution now, I think the work lies now at the regional levels for people to now venture into the next critical steps of contextualization and integration of this global framework at both national and subnational levels. I think it's also important because of local vulnerabilities being different in different regions, but also that healthcare commitment in government budgets are very different. And we have to work with that as well as the intersectorality of this work. And we really need to integrate with disaster management and preparedness as well as climate information services in a big way. And I think that's a very core principle that we'll have to follow when we contextualize this at regional level. I just wanted to, share that perspective from India.
Thank you. Very, very good. And I think that was a very good ending at the same time. And if I were to add probably last few words in the context of universal health coverage, in the context of UHC or health for all. So I think this is timely as what colleagues has intervened just now. We'll keep on communicating and working on this. We'll get ourselves learn and experience from other parts of the world on how you implement and integrate these climate resilient and environmentally sustainable healthcare facilities into your health program in your countries. Not only probably health program, but also the development program in your countries. If I were to be slightly more ambitious, but as what our colleague also said, that don't overlook into the broad context, thinking out of box in the context of planetary health. That the health of the planet is what we are thinking about here. And these overall issues about the COVID-19 discussion and interface that we are working on here. So with that, I would like to hand over this back to Elena, probably the final recommendation and probably some final words from the host. Thank you very much and congratulations from our side to you all for having a very, very good intervention. Thank you.
Thanks so much, Nasir. Thanks for doing this great job in moderating the overall discussion. With this, I would like to give the floor to Dr. Diarmid Campbell-Lendrum again, so that he can basically summarize the key points discussed and agree on next steps. So Diarmid, please go ahead.
Thank you very much, Elena, and thank you really to everybody who has participated in this discussion. I know it's been a lot of work from the team to produce this document with a wide range of consultations, but we sometimes get a little bit focused on just producing the document and getting it out there. And I'm really, really pleased that we were able to hold this webinar, and then there will be another one for different time zones this afternoon. Because the feedback that we've got, I have to say, has been enormously valuable to us. Mainly, firstly, just for the validation that this is a useful exercise, that this is a useful, well-placed and timely document. I would say not just because of the quality of the document, but also because it's come at a time when we're able to pick up on lots of other related initiatives that different partners and different countries around the world are producing. The people are already moving on this, and our guidance is therefore just an opportunity to bring this together. I just have a few points. I'm not going to be able to do a completely comprehensive job of capturing everything, but I took away a few points on this. The first one is on the scope, and I think several people have referred to different parts of this where there are related initiatives already ongoing. So there's fantastic work which is going on sustainable procurement. So we're involved in the SHIP project led by UNDP and others. There's fantastic work going on by Healthcare Without Harm on plotting out a global roadmap for green and sustainable healthcare around the world. There's fantastic work by our colleagues who in the emergencies program who are focusing more on the resilience side. And I think what we need to try and do is to continue not to try and fold these all into one box, but to maintain the linkages between them, because they all reinforce each other. And I think we need to try and keep this moving as a set. And just to reassure our colleagues who are asking the extent to which health systems people were already involved, emergencies people were already involved, Elena, Carlos, and the team here, I think, have done a fantastic job of getting the inputs of all of those programs, at least within WHO headquarters and also elsewhere. So I think we're doing the right thing in taking this forward as a set, but it's something that we need to carry on working with you on. The second point is on how we build this up and how we sequence this. And I think there was a really good discussion on that, and it was extremely heartening to hear that countries were not only sort of waiting for this or very keen to pick this up, but the reason they were keen to pick this up was because they're already moving on it. So Fiji was already doing work on this, writing their own guidance, and we came out with our guidance so that they could incorporate it into the national guidance. Maldives has already done work on this, and it was fantastic to hear the intervention from India, that these principles are already being included in the Indian national standards, if I understand that correctly. Because that even if that was the only thing that was done, that would be a massive step forward. India is a country of 1.3 billion people. Healthcare is a rapidly developing, growing global economic sector in India and around the world. If we're able to mainstream this kind of thinking right from some of the smallest small and developing states through to some of the most populous, largest economies in the world, then we're already, I think, having a massive impact. And it sounds like the way that we need to build this up, and our colleagues from Iran described this, and also from the UK and elsewhere, is yes, we do need to pilot, we need to contextualize this, we need to build it up from smaller experiences to wider experiences, but then it has to basically just be mainstreamed into the national guidance, because we also know that we have to move fast. We can't see this as something that we can take decades to develop as an approach, because the climate crisis is already upon us, and also the decisions that are taken now, particularly around infrastructure, particularly around the future direction of the healthcare sector, will have a massive impact on environmental sustainability globally. And countries that are the highly vulnerable countries like Maldives or like Fiji or like low-lying areas, basically their success depends on everybody else's success as well, because it really matters in those countries, it really matters what India, China, the US and Europe are doing, because it's their actions which will determine the amount of hazard, the amount of damage that is sustained. But I think we have a really good, a clear path from building out, from piloting to larger scale interventions. I also think there was a really useful discussion about the financing of this as well. And people talked about project financing and the need for the Green Climate Fund. I saw there was discussion in the chat about the Green Climate Fund or other bilateral funders, all they have in basically seed funding, funding projects which can start to mainstream these approaches. But what was also really useful, I think, was that people were not assuming that all of this will be funded by project funding from donors. Part of it needs to be, particularly at the beginning. And I think the comment has also been made that for the moment, there is very little funding that is going from the multilateral climate finance, like the GCF, into health. That has to change in order to get this going. But once we do get this going, then it's much more about just mainstreaming this into the investment plans of the sector. It should eventually just be the way that business is done. And the point was also raised that many of these interventions will actually save money. And it's important to document that and to quickly go for the ones that will save money. But we also know that in many cases, there's a high upfront cost in order to put into place, for example, a sustainable energy system, and then the savings come back over time. So we have to be therefore thinking about what are the financing models that allow countries to put into place these interventions, but to save money even if those returns come back over the long term. So are there ways in which we can raise, use financial instruments to get that investment in place so that all of the benefits can then pay back over the long term? And another really important point that was raised was to not underestimate the importance of the health sector and the healthcare sector. I mentioned at the beginning that healthcare is responsible for something like 5% of global greenhouse gas emissions. But even more important than that, it's about 10% of the global economy. And so what the health sector does, what it does in terms of purchasing decisions or in terms of advocacy, setting the tone for the importance of addressing the climate crisis and reducing our environmental footprint has a massive impact. And sometimes I would say those of us who work within health forget that, because we see that health is often under financial pressure, that demands are always greater than the supply. But we should really recognize the fact that if the health sector can organize, whether it's through purchasing agreements or whether it's through the voice of the health sector, then it really does have a much bigger voice than I think we've appreciated up until now. And so the final point that I wanted to make, which is always the most important point, which is about the people. It's one of the 4 items that we highlight within the guidance, but it's much broader than that. And I was very pleased to see people raising questions about the role of education of healthcare professionals in this. Like many of these things, we can't do everything in one document, but we and others have other work which is addressing this, which is related to it. So part of the answer to that question is that colleagues of ours at the International Federation of Medical Students Associations have surveyed the extent to which medical courses cover climate change. And the answer is that only about 15%, I think, of medical courses currently cover climate change. But that is growing pretty fast, and it's growing fast because of the pressure of basically the new generation of healthcare professionals that are coming in. They're demanding education on this. We're responding to that from the WHO side. We have a new WHO Academy, which is just about to launch. And one of the first courses that will be run through the WHO Academy will be on climate change and health. So that role of education of the next generation is critically important. And I think it was Charlotte who made a really good point that young people are demanding this. And in fact, if we want to attract young people into healthcare, one of the questions that they will ask is, well, what are you doing about sustainability? Because that is so much at the forefront of young people's minds. So talking about sustainability is now a pull factor, I would say, to get the best people into the healthcare sector. And we know once we bring them in, they will also be the best advocates for driving climate action overall. So I think the final point I would like to make is coming back to the Godliev's question about we need to also put this in the wider context, and I think that's critically important. So I'll just take this opportunity to advertise. that I think we maybe thought that this document will be a bit of a dry technical document, and I think it's fantastic that the discussion has been much broader and wider than that. We have other opportunities to engage in this broader discussion. You may be aware that WHO in May launched a manifesto for a healthy and green recovery from COVID, with 6 prescriptions for the big ticket items that we think countries need to bear in mind, so that when they're investing these trillions of dollars that are now going into COVID recovery, they do so in such a way that it promotes rather than harms health and protects the climate and the environment rather than harms the climate and environment. So I'd like to refer you to that document. And then finally, by way of advertisement, our next opportunity to take forward this wider discussion will be on the 9th and, well, it's the 9th of November. There will be the launch of Race to Zero Dialogues, which is an initiative by the UK and the Chilean presidencies of the climate change conventions to set the agenda for the run-up to COP26 in Glasgow next year. And this will be a series of 24-hour dialogues around some of the major climate change themes, around energy, a day on energy, a day on transport, a day on food systems, and so on. But the first of these will be on health. So I would say for once, health is setting the agenda for the climate change discussions. So we're just starting to, we're well advanced in the planning, but we'll be starting to go more public on the announcement of this. But I would like to invite you all to basically tune into and participate in that discussion on the 9th into the 10th of November, depending on where you are in the world. I'd just like to finally close the meeting by once again thanking the fantastic team which has been responsible for producing the guidance. So to Elena and colleagues and Carlos and others, to Annika for running a very smooth session, for the facilitators, the panelists, but most importantly to all of you who have engaged in the discussion. Thank you very much, and we will absolutely keep in touch. And I'll close the meeting there. Thank you.